FutureDad 35, COVID Part 3, The Lies of Lockdown, LOL. Quote, all tyrannies rule through fraud and force. When the fraud is exposed, they must rely exclusively on force. George Orwell. In the essays FutureDad 13, COVID Part 1, Safetyism, and in FutureDad 18, COVID Part 2, Lockdowns Were an Attempted Communist Revolution, I detailed the underlying psychological conditions and political motivations, respectively, of the phony medical lockdowns of 2020 to 2022. In this essay, I discuss the 12 major deceptions used by administrative zones to support lockdowns as well as promote medical experiments afterwards. I label them administrative zones rather than countries because they were not acting as countries. When a nation-state acts in concert with unelected globalists and exploitative corporations against the freedoms of its own citizens, it is no longer a country or nation-state worthy of that name. The lies and criminality are listed below, from the least to the most egregious. 1. Stay 6 feet apart to stop the spread. 2. The NHS, or any public health service, are angels/saviours. 3. That everyone should wear a mask. 4. We're all in this together. 5. 2 weeks to flatten the curve. 6. PCR testing. 7. That COVID was dangerously deadly. 8. Suppression of opposing voices. 9. Deaths with, not from. 10. Deaths within a month of diagnosis are COVID deaths. 11. Quarantining the healthy. 12. Safe and effective. 1. Stay 6 feet apart to stop the spread. Quote, screening in nearly 10 million residents in Wuhan, China, revealed that the asymptomatic transmission of COVID-19 didn't happen at all. Published in Nature, November 20th, 2020. The 6 feet myth was a total fabrication from the beginning. An aerosol scientist, commenting on the 6 feet apart decree, admitted it was made up based on past speculation. Now, a finger in the air guesstimate is acceptable if you are chipping a golf ball onto the fairway. It is not acceptable to help make a draconian new rule to restrict the daily freedoms of billions. To inflict this guess on free, law-abiding citizens is an unconscionable misuse of power. There's very little to say about the validity of the science, given it doesn't meet any basic criteria for science. The only thing this lie deserves is the most scientifically damning indictment that it is not even wrong, i.e. it doesn't even make the minimum standard of falsifiable. It's as invalid as the oft-repeated nonsense that we only use 10% of our brains, which ironically might actually be true here. No system of checks and balances leapt in to curtail this nonsense either. What use is scientific inquiry if moderating, counterbalancing forces vanish when political leaders arbitrarily decide they want to push things through? We cannot say with any confidence that a similar swindle won't happen again. The only thing to protect us from the being fooled next time is the near total destruction of public trust in our institutions. 2. The NHS or any public health service are angels/saviours. Many careers involve risk. Only some think that worthy of public adulation. A socialist edifice like the NHS took on a religious posture when they were asked to simply do their job during the scamdemic. Their job doing was cheerled all the way by smug, preening journalists and their pseudo-virtuous familiars. Why? Read FutureDad 18, COVID Part 2, Lockdowns Were an Attempted Communist Revolution. In summary, if you are an equality-obsessed communist failure, you are giddy with the idea of everyone locked in their cage for the greater good. Nothing frightens a communist more than freedom. Conversely, nothing excites them more than a compliant, safety-obsessed society. That's why they lionize the monuments of that safety, especially the giant albatross around the neck of a nation, its tax-funded health system. A left-wing journalist's idea of heaven is a fat nurse with a syringe, dancing on your nation's grave forever. 3. That everyone should wear a mask. Quote, these findings indicate that countries with high level of mask compliance did not perform better than those with low mask usage. The moderate positive correlation between mask usage and deaths in Western Europe also suggests that the universal use of masks may have had harmful unintended consequences. Curious Journal of Medical Science. Quick logic puzzle. If masks work and you want to wear one, then why does anyone else need to wear one? There is no rational answer to that from mask enthusiasts, not then and not ever. On an unrelated note, masks and assorted materials became a multi-billion-dollar business overnight. Many of those business contracts to supply masks were given to friends and acquaintances of political leaders. Until such persons go to jail en masse and the stolen money seized, this remains an uninvestigated misappropriation of public funds and a crime against humanity. 4. We're all in this together. Quote, 60% of restaurants who close will never reopen. Report by Yelp, September 2020. Quote, FBI paid Twitter $3.5 million to do its bidding. Twitter files, 20th of December 2022. Many have purged the memory of the lunacy and open criminality that enveloped society during lockdowns, perhaps mostly out of shame. So it's worth recalling that yes, the British public were propagandized to bang their pots and pans together on a Thursday for the NHS, while its employees danced like unsightly hippos in TikTok videos. Yes, senior politicians informed you to stay in your home for your own safety while they partied in secret. Yes, secret deals to provide equipment were struck with college buddies, while issuing mandates to require such equipment. Yes, unelected bureaucrats enacted blanket bans of small businesses, while supermarkets and fast food chains, which are listed companies with shares available to politicians' families to buy anonymously, could stay open. In terms of cui bono, the message is clear. Less than 1% of us were actually in this together. That 1% were far more than 6 feet away from the actual devastation and untold misery they themselves caused. 5. 2 weeks to flatten the curve. Quote, no cases of the naturally immune person passing on COVID, by CDC, November 2021. Quote, 33% less excess non-COVID deaths among 18 to 64-year-olds in non-lockdown Sweden. National Bureau of Economic Research 2022. The bureaucratic managerial state loved the 2 weeks phrase. Anyone who's dangled a thread in front of a kitten to encourage it to chase knows the principle in action. Yet the idea that you can minimize the damage of a virus by staying away from each other for a fortnight, once it's a pandemic, is idiotic on its face. The spectacle of the general public months later, collectively bowing their heads and knuckling down for one more go, was truly demoralizing. As it got close to 2 years to flatten the curve, the public was awash with all the red pills being imbibed. This was a time when even normies started to realize that no one in power had any idea what they were doing. Worst of all, it was clearly the power and control that mattered, not the rationale. As we came to realize, it was also deliberate. The power and profits were too intoxicating to let go. 6. PCR testing. The PCR test was so deeply flawed its co-inventor, Carey B. Mullis, distanced himself from its use. A test that literally amplified the detection many-fold to give a positive result. Other testing methods eventually took its place, but it was already fait accompli in terms of gaslighting everyone about a high transmission rate. 7. That COVID was dangerously deadly. COVID death rates are 10 times higher in countries where more than half of the adult population is overweight, by the British Medical Journal, March 2021. Quote, 26% more excess non-COVID deaths among 18 to 64-year-olds in the USA, deaths mostly circulatory, diabetes, obesity and alcohol suicide, 2020 to 2021 versus 1999 to 2019 average, National Bureau of Economic Research and New York Times, June 2022. I knew there was something wrong at the start of the scamdemic in early March 2020 when the articles were full of conjecture about a 5% fatality rate. It seemed especially coincidental that around that time a leaked video of a man collapsing on the street in China went, ironically, viral. Thus began Project Fear in earnest. But if you are semi-intelligent and you stop to think about it for a second, did the drop-down dead portion include all the infected who had a minor symptom and survived without incident? Once you consider the greater size of the denominator, the entire infected population, then the true fatality ratio could drop by a factor of 100 or more. But it was too late and too slow to use common sense. The scaremongering had worked its magic. As SAGE, the Scientific Advisory Group for Emergencies, to the UK government, said in March 2020, quote, the perceived level of personal threat needs to be increased among those who are complacent, using hard-hitting emotional messaging. So, a gullible world braced itself to be confined to its grubby little hovels, whilst the elite class lounged by the pool, wondering how next to pull the wool over our collective eyes. 8. Suppression of opposing voices. On 9th of December 2021, the popular TV show Good Morning Britain deleted a poll after 89% of Brits said no to mandatory jabs. This was part of an orchestrated media campaign by the industry, some of whose most significant donors are the pharmaceutical industry. One by one, dissenting experts were squashed by the mainstream media and complicit tech platforms. This included Dr. Robert Malone, the co-inventor of mRNA vaccines, who was banned from YouTube and LinkedIn. Skeptics and concerned epidemiologists tried to pull their voices in the Great Barrington Declaration. It was a plaintive cry of the unimproved, whose opinions were unprofitable and therefore wrong. It led to nothing. Even post-lockdowns, the footballer and commentator Mark Letitia had his after-dinner speaker engagements cancelled because he previously argued against the jab. 9. Deaths with, not from. Quote, in 45.3% of cases, COVID-19 was not related to deaths with COVID-19, Greek hospital study, April 2025. A simple word game was one of the most egregious parts of the lockdown-related assault on our language. A death with COVID was conflated with a death from COVID. What better way to administratively turbocharge the lethality without a single biochemical change needed by Fauci's bioweapons division? This simple but enormous padding of the numbers neatly extended the tyranny. It kept the little people in their homes for months longer, sometimes unable to save their small business or attend a loved one's funeral, all by swapping one word for another. Of course, we already expect politicians and the propaganda arm, the mainstream media, to lie to us. But to do it so obviously and uncontestedly speaks to the demonic nature of our journalist class and the shameful obedience of the general public. 10. deaths within a month of diagnosis are COVID deaths. Quote, the daily COVID death count shows deaths within 28 days of a positive test. UK Office for National Statistics, March 2021. 28 days out from diagnosis, even if death was from falling off your roof, you were deemed a COVID fatality. What more can be said about the obvious padding of the numbers? This is the same category of primitive but effective deception as deaths with, not from. There exists an unelected government health department ghoul who devised 1 month as being the limit they could get away with. In more honest times, these vermin would be under a prison. No one has been publicly censured for this, so it will happen again. 11. Quarantining the healthy. Quote, lockdowns led to a 0.2% reduction in COVID mortality by Johns Hopkins study, Jan 2022. Quote, 51% increase in female suicides ages 12 to 17 by CDC, June 2021. Quote, we did not detect any laboratory confirmed COVID-2 transmission from asymptomatic case patients is in line with multiple studies. CDC, April 2021. Quarantining the non-symptomatic has never been done in history. It stands out as the biggest, most spiteful act of harm perpetrated on the human race. It is a constant reminder of our failure as an intelligent, justice-driven species that both the organisers and the cheerleaders of this crime still walk free. The idea that hospitals are to be protected from the sick by indefinitely confining healthy people to their homes was an act of catastrophic evil perpetrated by the political elite. The lockdown of healthy people has no basis, in fact, whether 2 weeks or 2 years. In Britain's case, it was to help protect the monstrous bondugal of the NHS. Any health service which needs protection from people falling sick is a sick health service in the first place. See FutureDad 17, Britain is already socialist, and FutureDad 33, How and Why the West, in particular the UK, will collapse. Asymptomatic spread was offered as an excuse, yet 7 of the 8 data points indicating this magical idea came from China and were unable to be verified. The 8th was later proved to be hiding her symptoms for business travel. The whole endeavour once again meets the definition of so fatuous it's not even wrong. Massive societal damage was inflicted on people's mental health and their ability to screen for real diseases. Real damage was done to people and their loved ones to help stop fake damage. It could be the slogan of the human race. 12. Safe and effective. Quote, UK was 68% unvaccinated as of October 2021. 82% of COVID deaths and 68% hospitalisations were of the vaccinated by UK Health Security Agency, November 2021. Quote, across 2022 and 2023, 102,000 excess deaths in the UK, 652,000 excess deaths in the US, Dr. John Campbell. Quote, 63% of 2020 funding for MHRA, UK Medicines Authority, came from the pharma industry. Info request, July 2021. So you may ask, why not avoid awful lockdown restrictions by getting the jab? The jab and the lies around it is a special topic, deserving of an essay all on its own. Instead, for now, I will simply list the reasons for my own permanent unjabbed status. 1. Like other flu shots, it is a temporary remedy, not a vaccine which confers full lasting immunity. 2. My age and health meant I had a 0.03% chance of fatality from the virus, therefore not worth the risk of taking an untested medical intervention. 3. Severe systemic adverse events were reported by 5 to 10% of trial subjects, according to a Penn Medical Center in December 2020. 4. The endless media, big pharma and government propaganda suggested ulterior motives, including the clear financial incentive of mandatory enforcement. 5. Its development was rushed for emergency use. 6. The ubiquitous lies around COVID, see elsewhere in this essay, made me strongly suspect the danger was exaggerated from the beginning. 7. There is no strong evidence that COVID-19 exists. It hasn't been independently isolated in laboratory conditions. Even if it does exist, so do many other viral diseases, which I have survived on my own and am stronger for it. 8. On 20th November 2021, the FDA requested a court grant it 55 years before releasing data on the Pfizer COVID-19 vaccine. So in the end, the only immunity the vaccine conferred was the one sought by the manufacturer. 9. Non-compliance deeply annoyed obsequious leftist drones and obedient commies. This became very important to maintain for my sanity. 10. Coercion breaches the NAP. Mandatory jabs are illegal. Public Health Control of Diseases Act, England and Wales 1984. Enforcement breaches UNESCO's Universal Declaration on Bioethics and Human Rights, accepted unanimously by 191 member nations, regarding medical consent and bodily autonomy. 11. The 9 pages of side effects of the Pfizer jab. It is only 5 years later that we see a mass proliferation of defibrillators on the streets, that the veil has been lifted on the obvious long-term damage that was done. Every time I see one, I am reminded of my decision, and I give silent respect and admiration to all of those brave enough to say no. In conclusion, the global COVID heist was a shameful and wicked period in human history. It was marked by gaslighting, racketeering, coercion, suppression, theft, wrongful imprisonment, and mass poisoning on a global scale. It isn't over until its instigators, exploiters, and cheerleaders are rotting in prison. FutureDad.